we're having patients coming in with neuropathy. One lady named Nan, she comes in, she's like, my doctor said I need to lose weight because I'm going to be on a leg prosthetic device. I looked at her legs and they're like that dark brown leather, ready to be chopped off. So I said, well, I can help you with your weight loss, but I bet you the program can also help you with your legs. Sure enough, 3 months later, she lost 55 pounds and her legs came back pink, the natural skin tone. And I'm thinking, okay, what's going on here? So I did some research and I started treating neuropathy. But I'm going to explain to you what caused neuropathy, what the information that I found out, and why it's such a great thing now. Because, you know, neuropathy patients actually come into their appointments. They don't miss appointments. So
hi everybody, welcome into today's masterclass. As you guys know, today's going to be hosted with the one and only Dr. Singleton. We're going to be talking about how to implement neuropathy program into your practice. Basically, he's going to be walking you through the program that allowed him to generate money into his office and give you guys like the A to Z breakdown as to how neuropathy works and how you can, help your patients heal faster. So go ahead, Dr. Singleton, you can share your screen and then I'll let you know how everything looks on my end over here so we can get started.
Okay, welcome to the world of neuropathy, right? I'm Dr. Singleton, graduated in 1990, had the largest MD DCPT rehab clinic in west of the Mississippi, 75 employees, MRI machine, billing out $700,000 to $800,000 a month in services. I mean, when your overhead's almost $300,000 a month, it's like, So here's my story, and I'm sticking with it. So we had these 70% of these patients that were coming in and getting well, but then the 30% were not getting the results they needed. So I tested them on a machine I have called the Biomeridian, and I found out there was a common denominator with all these patients, the 30%ers. They had a gut thing going on, the microbiome, before it was a microbiome thing. And so I thought, let's put them on a nutritional program, get the gut healthy again, and they're getting out of pain. Next thing you know, they're losing weight. And that's when I found out, by changing the gut, that's how we help people lose weight. So I opened up a separate weight loss clinic in 2006. And then a year later, we had this, we're having patients coming in with neuropathy. One lady named Nan, she comes in, she's like, my doctor said I need to lose weight because I'm going to be on a leg prosthetic device. I looked at her legs and they're like that dark brown leather, ready to be chopped off. They were going to do the right leg first. So I said, well, I can help you with your weight loss, but I bet you the program can also help you with your legs. And I was just hoping, and sure enough, 3 months later, she lost 55 pounds and her legs came back pink, the natural skin tone. And I'm thinking, okay, what's going on here? So I did some research and I started treating neuropathy. First, I ran an ad and had 36 new patients on the first day. And it just kind of a little bit more than I expected back in 2007. And so, but I'm going to explain to you what caused neuropathy, what the information that I found out, and why it's such a great thing now. Because, neuropathy patients actually come into their appointments. They don't miss appointments. So, and since that time, we've trained over 2,500 clinics nationwide. I've spoken for TCC, Life, Parker, Florida Chiropractic. Been all over the world speaking, and it's just something that I do, gut-brain connection, how to help doctors enjoy better success, okay? All right, what is neuropathy? We're going to talk about that. A lot of them, doctors talk about, well, it's reduce blood flow. That's a true statement, and nerve damage, but what is beyond that? What's the domino at the head of the game here? So peripheral neuropathy, it's estimated that 20 million people in the US have some form of peripheral neuropathy, a condition that develops as a result of damage to the peripheral nervous system, down in the hands, down in the feet. Neuropathy means nerve damage and disease. And by the way, if any doctor that's going to be watching this, if they want some copies of these slides, at the very end, I'll give you my contact information too. Diabetic neuropathy can flare up suddenly and affect specific nerves. One can develop like double vision, drooping eyelids, weakness, atrophy in the muscles, Nerve damage caused by diabetes can occur over a period of years. It leads to things like the digestive tract, sexual organs, can cause diarrhea, constipation, dizziness, bladder infections, and even ED. We're going to talk a little bit about that, what causes that. And that is something that a lot of people don't understand. They go to their doctor and there's a drug for all of those. You know what I mean? In diabetic, in fact, 70% of what I see that have neuropathy, they're not even diabetic yet. In diabetic neuropathy, one of the most common forms of peripheral neuropathy, nerve damage occurs in an ascending pattern. The first nerves to malfunction are the ones that travel furthest from the brain and the spinal cord. You remember in school, we were taught that the body heals from the head down, inside out. Well, the feet are the first to go. The feet are the stepchild of healing. And we're going to talk about why that and how that happens. Pain and numbness are often felt bilateral. It's very important that both feet, you're going to have both feet, because sometimes I'll have a conversation with a new patient before they come in on the phone, and I want to find out, is it on one side, is it both sides, and that. So it's both sides. And then sometimes there's some progression up the leg, then later can hit the hand, the fingers, and sometimes the arms. Peripheral neuropathies are due to the damage of the axons, the long thread-like portions of the nerve. Others are due to damage of the myelin sheath, the sheath that covers. You can kind of see some of the sheath that's covering some of these blood, or the vessels right here, the nerve vessels. It's like a fatty covering that coats and insulates the axon. Now, how can you tell it's neuropathy and not muscle or joint pain? Muscle pain is preceded by trauma or injury, while nerve pain isn't. It can come from known trauma, but not always. Muscle pain is an ache or pain in the joint or muscle. It feels achy, and there can be some stiffness, but neuropathy is more in nerve pain, burning, stabbing, tingling, and there is a big difference. So muscle pain stops after healing of the injury, when the injury takes place, after the injury takes place. Nerve pain will continue. Muscle and joint pain can be relieved with aspirin or other painkillers, while the same meds do not help nerve pain. We're going to talk about some of the like gabapentin, Lyrica, and Neurontin. So the World Health Organization estimates that by 2025, more than 350 million people will have diabetes that will lead to neuropathy, but which came first? And why do people have neuropathy that have diabetes? At the same time, people have neuropathy that's been through chemotherapy. Okay, we'll explain that. So symptoms vary depending on whether it's motor, sensory, or autonomic nerves. Motor nerves control voluntary movement of muscles used for talking, grabbing things, walking. Sensory, feeling the pain from a cut or light touch. And then there's autonomic nerves, visceral neuropathy, we call it, controlled activities like digestion, heart issues. People can have a heart attack and not even feel it. And then gland functions and even breathing. Now, symptoms, severe symptoms may include burning pain, like during the nighttime when everything else is gone. There's no stimulus outside, and they're just lying there. They're going to have a lot more pain. Muscle wasting, paralysis, organ or gland dysfunction. And again, visceral neuropathy that impairs internal organs like digestion, sweating, sexual function, and urination. So those things are things that you go to a doctor and they give you, like I said, again, a drug, but they're all part of neuropathy. The good thing is that when you start to have numbness and tingling in your feet, that's like your dashboard in your car. It says check engine, like check feet lamp, check the feet lamp. So that's where it all starts. But yet things have been going on in your body for years before it shows up in your feet. Large sensory fibers enclose the myelin, register vibration, position, and light touch. And then damage to large sensory fibers impairs touch, which results in decreased sensation. So I really like this graph here for the motor nerves. They're myelinated up in here for like muscle control, touch, vibration, position, proprioception, and then down through sensory, it starts to get more thinly myelinated for cold, warm, and then down here where it's thinly or unmyelinated, that is in the internal organs, the visceral stuff, heart, blood pressure, sweating, the gut function, and all that. I just thought that was kind of interesting where they're myelinated and then where they're unmyelinated down there. And so neuropathy can feel like they're wearing stockings and gloves, even when they're not, like the socks are balled up under their feet. Interferes with the ability to feel pain or changes in temperature. Feel the sense that they've been injured from a wound or a cut that's become infected. I had a patient come in who was in one of those walking boots, and his dog was licking his foot, and he fell asleep, and he woke up, and the dog had blood on his face. The dog was chewing his big toe, and he didn't even feel anything because he had neuropathy really bad. And then that'll affect your emotional overall well-being, quality of life. And again, it can be worse at night, usually because it'll disrupt your sleep. And that in of itself will add the emotional burden of sensory nerve damage. I mean, things like the light, thin sheet draped over your feet will drive you nuts. So autonomic neuropathy, AKA visceral neuropathy, can affect the body's inability to sweat normally, heat intolerance, loss of bladder control, inability to control muscles, expand, and blood vessels to regulate blood pressure. So, you have visceral neuropathy, but you're on blood pressure medication. So let's look at that. What causes peripheral neuropathy? What triggers foot neuropathy? Peripheral neuropathy can be result from traumatic injuries, infections, metabolic problems, being overweight, inherited causes, exposure to toxins. One of the most common causes is diabetes, like we said. And you can see those toes right there. Don't put a regular E-stem machine, chiropractic E-stem machine on your patient's feet because it'll burn a hole in them. And a lot of them wouldn't even feel that. The problem is they become infected, and they can't heal. They turn gangrene, and that's why they have to do amputation. So is this a disease or a disorder? Okay. There's different models. The medical model, it's like amazing how they kind of miss the mark, but here's stages of neuropathy for the medical model. Neuropathy is a chronic condition that results from damage or compression of the nerves outside the spinal cord or brain. One suffering from neuropathy may experience a variety of symptoms such as pain, tingling, numbness, burning, or weakness in the affected extremity. These symptoms often vary depending on how long the nerves have been compressed and the level of damage they've been sustained. When a patient has neuropathy, it is beneficial to understand which stage they are currently at. So our surgeons, you like that? Our surgeons may evaluate the extent of nerve damage they have already experienced and what treatment options to benefit them. Benefit? Stage one, in this beginning stage, patients become aware that something feels off with the nerves in their hands or feet. They may feel pain, numbness, or a combination of the two. Somewhat infrequent, individuals may also notice a problem with their balance or reflexes. The problem may not seem too severe during the stage, but many patients continue their daily routine without seeking medical treatment. However, the sooner a patient seeks treatment for neuropathy, the better the surgical outcomes may be. What the surgical outcomes? Is everything surgery? I guess so. Stage two, in this stage, the patient's pain becomes more apparent and becomes more difficult to endure. This stage is a great time to seek medical treatment to get the root of the neuropathy. The root, right, before the nerves become more permanently damaged. Stage three, intense. In this stage, patient will experience the worst pain, usually occurring every day. Many patients will have issues during this task that they used to do without hesitation, such as walking barefoot on the beach in San Diego. This stage causes a huge impact on the everyday lives of the patient and is truly unbearable. This is the stage many of our patients decide to go with surgical intervention and have our surgeons perform nerve decompression surgery. I mean, do we have like stupid written on our face that, let's do surgery? There's nothing else out there available. Stage four, complete numbness, loss of sensation. If a patient doesn't seek medical treatment now for neuropathy, they will begin to lose all feeling and risk wounds. The subsequent amputations will increase. It will be extremely difficult to balance if your affected area is your feet, and it will become troublesome to complete basically anything. Okay, so these are some stages that people buy into, because I've had some patients who have actually had the surgery, and let me think, they still have neuropathy. Imagine that, because that's not that wasn't going to fix anything. Let's talk about nutritional deficiencies affecting the nerves causing neuropathy. Metabolic or endocrine impairs the body's ability to transform nutrients into energy and process waste products. So you want to be able to digest, assimilate, and then eliminate toxins. Diabetes mellitus, characterized by chronically high blood glucose levels, lead to a fatty liver. But which came first here? It's actually a fatty liver was first. Is a leading cause of peripheral neuropathy. And as you can see, all the other things that it can affect down there, from insulin resistance, weight gain, high blood pressure, eventually heart disease, cancer, and then later dementia, which is type 3 diabetes. And then just your body, everything goes down. I had a patient in the other day. I had her on one of my machines and I cranked it up to 100. This machine, I've only seen like 3 patients this way. She's waited so long that I cranked this up so high, she didn't feel anything. So she was this close to losing her feet, but now the last couple of weeks, she actually is feeling better. So I'm happy about that. 60 to 70% of people with diabetes have mild to severe forms of nerve damage that can affect sensory motor and then again, autonomic. And also thyroid hormone slows down, fluid retention, swollen ankles. And then there's this thing called candida that I teach doctors too. Candida is an infestation of the body of yeast, because candida, when they eat, they poop and they have microtoxins, and that creates this fog density throughout the body. That affects how thyroid hormones, fluid retention. So if you look at the feet on the left, we see patients that come in like that. And I mean, you don't want to get a sharp object around them, because if you pick them or poke them with something sharp, it's just going to open right up. And they have a hard time walking. There's so much pain. Now, can chiropractic care, can back pain cause neuropathy? Well, any type of condition or injury that compresses a nerve can lead to neuropathy, like unilateral, one side. A disc herniation is a good example of a back injury that can result in neuropathy. Other forms of neuropathic pain that originates in the spine or back include the following, like sciatica, can refer down the leg, and that foot can feel neuropathic, or cervical down into the hands, fingers. Then they do carpal tunnel surgery, or failed back surgery that can persist and create damage to the exiting nerve roots in the lumbar spine. And that you can feel that in the periphery, then the feet. What destroys the gut and microbiome leading to neuropathy? Well, eating a diet rich in sugary, starchy foods feeds the other unhealthy gut flora that you want to keep low, like candida. You want to keep that at a low. In your body, the sugars and starches feed candida, but they'll also weaken your immune system and reducing your body's ability to fight off any more yeast. Suppress the immune system, allowing yeast colonies to multiply rapidly. Starches take a long time to digest and end up feeding harmful bacteria that works with candida to cause problems. And this is all leading into the cause and why I'm talking about this right now. Other lifestyle factors: alcohol, antibiotic use. So if patients eat fast foods, restaurant food, remember 80% of all the antibiotics out there are injected in animals. So if you eat any restaurant fast food, you're going to destroy, again, the gut, the microbiome. Caffeine, these can destroy the healthy microbiome that also keeps the candida in check. Antibiotics kill the weakest bacteria in the gut. Each time they're used, the strongest bacteria survive and multiply. Or have chemotherapy, and that'll also destroy your gut. Steroid drugs, cortisone, prednisone, have a similar impact to help increase candida in the body. But you're in pain, what do? You go to doctor, they want to shoot you up with a steroid. Now, how is peripheral neuropathy diagnosed? You can do a physical exam, sensation, vibration, light touch, position sense, temperature. There's some different things that you can do to go from the toes up to the ankles to say, hey, tell me when you can start to feel this. But this is good. I like this, but my favorite is using temperature trending. So we can determine a person's temperature, like that picture there that you can see of the feet. Like there's the cat or the little shooter gun laser thing. They're like $30-$40. You can get those on Amazon. So, but I use a thermal imaging camera. So if you look at that foot there on the left, this is a patient before treatment. 87 degrees down there. Can you see how the toes look gray? You can't see that without the camera. 93 in the ankle area. Then this is after treatment, 3 months, 98 to 102. So this is where you're supposed to be. And so this is what I like to do. And I can show you how to use this camera. This is a camera that I'm using now. I mean, you don't have to spend $10,000, $12,000. This is a camera called Seek Shot Pro for $699. And I have videos of how to actually use this camera in your office. So true or false? If your right foot was 4 degrees colder than the left foot, which foot are you going to lose first? We have the right foot. So the colder foot is the one that you're going to lose toes first. The colder foot will go first. Now, here's the cause. Malnutrition neuropathy. Crazy. Is caused by eating yourself sick, eating food out of a box bag or can. These foods are all dead foods. No live enzymes are present. Now, this condition of neuropathy was brought to attention during World War II. This provided an unprecedented opportunity for observation of the effects of nutritional deficiencies. Men of many races were subjected to years of defective nutrition as prisoners of war. Look at the young soldiers there on the right. You know, they're malnourished and they start to lose their legs and their feet because of malnutrition. This malnutrition affected the most highly differentiated cells of the organism the most. In fact, they found that the nervous system shows the most severe and most common lesions. These findings were not due to where the men lived on the planet. They were the same no matter where they lived. Malnutrition was the only common denominator in all of these physical elements these men experienced. This is essentially a degenerative or catabolic nature arising under conditions of deprivation. The imbalance of the altered diet being given to the POWs affected their GI tract, leading to defective absorption, defective biosynthesis. Due to the deficient diet, reduction of good quality proteins, fats, and vitamins, the body was starving for balanced food. Malnutrition. Okay, well, I'm seeing patients in the 50s to 100, and they're malnourished too, because look at all the crap they're eating. Okay, vitamins are depleted. They're developing neuropathy. We try to get your body 100% nutrition, but most people are only absorbing 30 to 50% of what they're eating anyway. That's why they go to coffee and caffeine and Diet Coke, which is the worst. Another study was done, a bariatric study, where they actually messed around with the stomach, cutting this and cutting that. So they basically disrupted the body's ability to digest and assimilate. And because of this, neuropathy came about. Again, malnutrition. Diet sodas. There's a Northern Manhattan study that talked about how bad diet sodas are. There's 3 leading death drinks: soda pop, skim milk because they add sugar, and then juices. You don't want to do juices either. Because even though you're doing the Diet Coke, well, it's sugar-free. Well, the aspartame, the pancreas, the body doesn't know, oh, this is fake sugar. It's still like fake sugar. The body still treats it like it's sugar. So that's one of the number one things I have to get the patients off of. In the US, 10,000 amputations are performed each month. Yowza. Once a patient who has a neuropathy and or diabetes moves to dialysis, there's a 10-fold increase of developing ulcers and amputation. Within 1 year after this result, 50% will die. Thus, an intense treatment from your office is imperative to prevent the downward slide to dialysis and then death. I have had patients that didn't want to do a program and they are no longer alive. So, because I like to follow up on them. The conventional medical approach to treating neuropathy. Research has revealed that many medications cause peripheral neuropathy, such as side effects. Ironically, even medications prescribed to help them with neuropathy, such like Neurontin and Lyrica, have been shown to worsen the damage to peripheral nerves over time. This is just a Band-Aid effect. Now, what about a holistic approach to treating neuropathy? Well, one of them is going down to a beach, finding an open water at sunset, and hold your arms open up that way, and I'm just teasing. I just like that picture. Okay, solution. The neuropathy program is amazing because it addresses any nutritional deficiency a person may have. It gets the body to start digesting and assimilating better food. It also allows the body to start healing from the inside out and decreases the degenerative process of the nervous system. So we do in-office treatments. We do this electric stim called the Tesla Max. So if you want more information about that, it's high volt, low amp. They actually used to use that for patients who already had amputation of the toes, and they had to increase the blood flow circulation down there to heal. So I talked to them about 12 years ago, and I said, let's just use this for prevention of amputation. It's been great. And then whole body vibration, there's been some studies on whole body vibration. You can also use some LED light therapy, different kinds of lasers, but they're attended therapy, cold lasers preferably. And then we do these leg wraps who were developed by a biochemist from UCLA. And then if you need to do any spinal decompression, if you have, find any lumbar areas that have been that can refer down to the feet. So hope that I have a ton of stuff. So this was a 2-hour presentation, and I shortened it down to half hour. Hopefully it wasn't too long, but if you want more information about this, and because I say I've trained a lot of doctors on this, and like just in 2 days, I'm only in the office 2 days, and using proactive marketing where we get these leads in, and 2 days I'm down there, $26,000 in 5 patients for treating them neuropathy. So if you want to learn how to do this, how to collect money, and how to do it right, because we just had an office here in town last Friday got shut down because they're doing stem cells, they're doing all these other things that don't work, and it doesn't help patients, and the patients complain. They go to the state board, and that place gets shut down. So you have to do it right. You got to really know how to treat the patients and not shortcut them. So if you want more information, there's my number. You can text me, or if you go on singletonsystems.com, click on a practice analysis, you can actually schedule a time to meet with me, and we'll see if this can fit into your practice, if it's something you want to do. If you're already doing it, I can maybe tighten it up, help you here and there.
Mhm.
I am the GOAT of neuropathy. It's only Tom Brady and I can say that.
The goat. I love that. Yes, and based on the presentation, I think it's really beneficial, guys. Any doctors that are here listening and contemplating to implement neuropathy into the practice, Dr. Singleton is the guy. So yeah, anybody has any questions regarding neuropathy, like Dr. Singleton said, go ahead and message him, check out his website, or you can even drop a comment down below here, or like a post in the group about neuropathy, and then our team will be sure to communicate with Dr. Singleton so you guys can get the support you guys need on that. But cool. Thank you so much, Dr. Singleton. The presentation was amazing. I have a few questions that I kind of put together on my end as you went through the presentation. Some more of like curiosity on my end, and then some are more for like doctors who may be asking the same questions that I have. So the first one is, do you find that after the time that you've been hosting neuropathy in your practice, do you see it growing to become more of a bigger treatment and something that more patients ask for nowadays compared to back then?
Yeah, because as people's health gets worse and worse, neuropathy is skyrocketing.
Right.
Younger. I'll get them in their 30s and 40s now.
Oh, wow.
They're much younger now because they're drinking 6 sodas a day, and they're eating fast food, and they're destroying the microbiome. And so again, starvation, which is allowing their feet to develop neuropathy.
Yeah, okay. Well, I was not expecting people at that age to come to your practice, but that makes sense, especially with, I know, like nowadays and here in America, the diet system is not the best.
Yeah.
So it definitely makes sense why you're getting those visits. But I just ask because, like, guys, this is something that's growing, and if it's a treatment, that's something that's going to be kind of like, I don't want to call it evergreen, but just something that's becoming more of a popular thing. It's always best to hop on something now, implement that into your practice, and then ultimately help more patients get better, heal your community and such. So
I basically do the exam. I get the new patient coming in. I get them to join, and the staff, they do all the therapy. So this is great. The kind of practice I have with weight loss and neuropathy, if I can take off a week or two, and the staff are still there treating patients. I don't have to be there every day adjusting. So I can go whenever I want. So this is a great way to practice.
That's awesome. Definitely, yeah. And I imagine you train your staff yourself, right? Like when they first joined.
Right. Yeah, we train them. We have a website that also trains staff and doctors. Yeah.
Awesome. Cool. And then my next question here for you, just for clarification, medical practice doesn't necessarily heal neuropathy fully, does it?
No, not at all.
Not at all.
It doesn't.
Unless you're dealing with a patient that wants to do the surgery, guys. Like, I know surgery is something a lot of people try to avoid doing. It's life-changing, like Dr. Singleton mentioned in the slides. It impacts the quality of life, and I can only imagine that once the surgery is performed, it doesn't really help. So yeah, that's just something to consider, the fact that medical practice doesn't necessarily fully heal neuropathy.
So, if the patient ever asks you, hey, does my insurance cover this? I'm like, well, if insurance covered it, you wouldn't have neuropathy because it doesn't cover anything that works. So I actually have an insurance uh, thing here. I'll read to you quick. It's a guideline, section 2251.3. A treatment plan that seeks to prevent disease, promote health, and prolong and enhance the quality of life, or therapy that is performed to maintain or prevent deterioration of a chronic condition is deemed not medically necessary. So basically, it means good luck, you idiots. You're putting all this money into Medicare, but we aren't going to cover anything that works for you. Well, we'll cover wheelchairs, surgeries, medications, but good luck.
Right. So in the common situation, neuropathy isn't always covered by insurance, but I do know that based on like other master classes that I've hosted with Dr. Layton as well, that there's always like, I'm sure you offer like, plans or like, is it like care credit for patients to take advantage of?
Exactly. Care credit will cover it, and those kind of funding and finance companies. So yeah, that's a really good option for care credit.
Exactly. Yeah. There's always ways to help your patients, financially, because I know that's a big thing too. And insurance unfortunately doesn't always cover things, but there's always ways that, within the practice itself, you guys can always help your patients with financial stuff too. Okay. And then this is kind of a question of curiosity. Do you have any situations where you combine your weight loss program or like your nutrition program with neuropathy? Because I feel like that only makes sense with what they're dealing with.
They will, a lot of them want to come in. So what I'll do is I'll take a picture of their feet and I'll do a treatment, and I'll take another picture and we'll show them that the temperature actually elevates, so we can actually see that there can be reversal. And a lot of them are like, well, can I just come in for the treatment? And I'm like, no, because we have to go after the cause. We always got them on the nutritional protocol, because then the side effect of this is they lose weight. One guy just came in yesterday and he lost 45 pounds in 3 months.
Wow.
Got off all of his medications. A1C goes from like 10 to 5. So they have to do the nutritional program, because that's, again, the cause of this.
Right.
I won't even treat them just if they want to come in and pay per visit either. No, I don't play that game. I used to do that because pain's the first thing to show up, the last thing to show up, first thing to go away. And they stopped coming in after 1 to 2 months. Hey, I'm better, I'm done. And I'm like, but you're not done. And then 2 or 3 months later, they go, oh, your program didn't work. So I'm like, I don't play that game anymore. You do it the way that we recommend, because we've had thousands of patients go through it and get amazing results.
Better. Exactly. I think that's the right way to go about it too. And yeah, that makes sense that they're going through the weight loss program now that you put it that way. Cool. Awesome.
We have all that set up. We have all the nutritional programs, the booklets, the manuals. So it's all spelled out A to Z.
In your do you offer that in the Singleton systems?
Yeah, it's in the Singleton system. All the programs of all, you don't have to reinvent the wheel. I've already spent the time, reinvented it.
Exactly.
And it's been working for years, and it works for all these other thousands of chiropractors across the country that are doing it. So I can't change something that works.
Exactly. Yeah, guys, Dr. Singleton already kind of did the trial and error, so he is the guy to ask if you guys are contemplating that. And this kind of like leads me into my last question for you. A lot of these doctors in this group are already doing chiropractic care, even weight loss and nutritional programs that they're doing themselves. What is kind of like, well, will it be easy for them to start implementing neuropathy care? Like how is that difficulty of bridging what they're doing right now to neuropathy?
Okay, so you're not there, 10 hours a day, Monday through Friday. There's even Saturday. So you set up a time, maybe you're half a day Tuesday or half a day Thursday. Set up a day. We have 2 or 3 hours where you can start seeing these neuropathy patients come in for the evaluation, and then they can even come in an hour or two earlier, because these neuropathy patients like to come in early too.
Mhm.
So there are different times of the day in practice where you can have neuropathy practice, and then your chiropractic practice. So you're leasing or renting this office 24/7, but you're not there 40 hours a week anyway. So let's find some time where you can actually start seeing these, because you only have to show up, sell them a program, and then your staff can do the rest.
Exactly.
I promise you this, you're going to make a lot more money treating neuropathy than chiropractic care.
I can only imagine, especially with like, with the climate of how like the nutritional health is in America. And then from there, I can also imagine doctors bridging those patients into chiropractic care to just fulfill the whole like healing without needing to rely on, medical, big pharma, all that stuff.
And we use a nutrition company called Solutions 4 that it's a doctor's only line. So patients can't buy it on Amazon like every other thing else that doctors sell. So it's something they have to get through you. So after they come in for their appointment, their visits, their 3 months or 6 months, then they stay on some of the nutrients, but they have to get it through you. So now you have this passive income of 5 to 15,000 a month, patients coming in, or they can order on the website the supplements that they love.
Mm-hmm. So just what did you do? Like kind of just white labeled it, or did you?
No, it's been around for about 45 years, this company. And I talked to the original owner, and I was able to get her to private label that for doctors, chiropractors in America.
Awesome.
Yeah.
So yeah, guys. Well, that's kind of like my wrap up for the questions here. And if anything that we just talked about right now, from presentation to the Q&A at this point, please drop any questions, comments down below. Dr. Singleton is here to help us out with just helping you guys essentially grow your businesses and heal your communities faster. So as always, thank you so much, Dr. Singleton, for your time today and for the presentation. And then for everybody else, please have a great rest of your Wednesday, okay? Thank you so much.